last week I was interviewed for the news in regards to people who were waiting for surgeries, and this is the article. I thought that maybe it would be um, also like a video, but I can't find a video anywhere, so I'm just going to read you what the article says really quickly. Hopefully, it is very long. Surgeries at Waterloo Region's hospitals threatened by Omicron, whatever it is called. So it says, I'm hoping and praying for the phone call that never comes, says Angela Williams. This is from Vanessa. This is Vanessa. This is the article. I will post the article down below if you'd like to read it. This is a terrible photo of me. Ugh. But anywho, Angela Williams, 45, has been diagnosed with borderline type 2 Chiari malformation. She was scheduled to get her first surgery to treat her worsening symptoms in March 2020, but instead has been facing cancellations, referral to other doctors, and wait lists since. And then I just stole that picture from my Facebook, apparently. Kitchener resident Angela Williams was diagnosed with Chiari malformation, a rare condition that puts irregular pressure on parts of her brain and spinal cord, at the end of 2019. She was scheduled for surgery on March 13, 2020, to address her neck pain, dizziness, migraines to prevent her condition from worsening. Despite tentative surgery dates and multiple visits to the ER, the surgery never came. It was scary, says Williams, who has since been seen by different doctors, specialists, and surgeons beyond the Waterloo region within the past 2 years. I didn't hear anything from the surgeons. I didn't hear anything from my family doctor. I didn't hear anything at all. Now, almost 2 years later, Williams is still waiting for the initial surgery without his date in sight, except now she sometimes wakes up choking on her own vomit, frequently loses visions in both of her eyes, and consistently battles some type of pain. I'm sitting here at a loss, says Williams, who says she's unable to work because of her condition. I'm hoping and praying for a phone call that never comes. Williams is one of the 11,000 people who are waiting for surgery in the Waterloo region. Hospital officials estimate it will take more than a year to clear. Throughout the last 2 years, hospitals were forced to step up elective surgeries twice, building on existing backlogs of surgeries that some cases existed before the pandemic started. Lee Fairclough, the president of St. Mary's Hospital and regional leader against COVID-19, says the region's hospitals have started to see the effects of delayed or limited access to other services such as MRI scans and other diagnostic testing. People are coming in sicker. Some of it may be because of limited access to care early in the pandemic, both at hospitals, but also with primary care. We're now seeing people coming forward with more advanced presentations of some of their conditions. About 60% of the region is fully vaccinated against COVID-19. While this has helped hospitals ramp up elective surgeries and more than 110% to get back on track, the Omicron variant is posing a threat to those short-lived plans. We also realized that being able to respond in January, we would be likely to reduce some of our non-urgent and emergent procedure work again. Right now, we are planning for that. Fairclough says region hospitals are looking to ramp up services to support people to get their third dose of the vaccine. In addition to preparing resources for the influx of admissions they're expected to due to Omicron cases. Fairclough says the demand for hip and knee surgeries is high, with ophthalmology cases accounting for more than 50% of St. Mary's backlog surgeries. To tackle the backlog of more than 7,000 surgeries, they partnered with the offsite provider TLC Vision earlier this year to run ophthalmology procedures at 130% capacity. Grand River Hospital backlogged by 2,000 surgeries have been operating six operating rooms and will going to 7 in late January and hopefully 8 by end of March, according to the communications manager, Shell Evans. Pre-COVID, the hospital would perform almost 10,000 surgeries every year. Cambridge Memorial, which is also about 2,000 surgeries on its wait list, has partnered with the Tri-City Colonoscopy Clinic to help with endoscopy proceeds, according to the communications manager, Stephen Beckhorn. We're also in the proceeds of exploring similar partnerships for other procedures, he says, adding, while there's some promising talks, nothing has been formalized yet. According to an email from the Ministry of Health, Waterloo Region hospitals, along with hospitals in Ottawa, Kingston, and Windsor, are all working with community partners to perform low-risk procedures in new settings to free up hospital operating room capacities. Despite community care and private partnerships, along with triage processes for surgeries, According to need and pain management, people can still fall through the cracks. I think the reality is the backlog and the wait times are increasing, and with each big wave, we're going to see the same effect. The backlog may be staggering for the region, but it's just a drop in the bucket for hospitals in Ontario. In November, a report commissioned by the Canadian Medical Association said it would take at least $1.3 billion to return surgical procedure wait time back to pre-pandemic levels. However, in May, it says it would cost $1.3 billion alone to clear the growing surgeries and diagnostic pre-surge backlogs, in addition to 3.5 years to clear the surgery backlog, assuming hospitals operate above capacity. The province allocated $6.10 million, less than half in the budget, to tackle surgery backlogs. Some of this has already been used by the Waterloo Region hospitals to train more nurses and fund surgeries. But the ministry has said the FAO report does not reflect actual current demands of patients waiting for surgery and diagnostic imaging procedures. Current data demonstrates that the overall number of surgery patients waiting in Ontario is not currently higher than before the pandemic, though as patients proceed through the upstream screening, referrals, and diagnostic assessments, more may enter surgical waiting lists in the coming months. The same email showed that the hospitals received $6.2 million in one-time surgical support, funding the operation on evening and weekends to catch up on surgery. The ministry says it led Cambridge Memorial Hospital to complete 92%. Grand River Hospital complete 86%, and St. Mary's Hospital complete 84% of their funded allocation in 2020-2021. Between then, the ministry says Waterloo Region hospitals receive a cumulative $2.6 million to support extra MRI and CAT scan operating hours. Waterloo hospitals also will be eligible for additional service recovery supports in 2021-2022 based on the level of surgical activities they achieve. Fairclough says, though, that hospitals and its community partners and nursing homes, pharmacists, and clinics are working together to prepare for another wave. They can't do it by themselves. My main message to the community is we're going to continually work very hard to strive for the right balance by those two choices and decisions. If you haven't got your first dose yet, please go get your first dose, because I think a variant will move quickly in a population that's unvaccinated. In her experience, Williams, back to me, I see. Williams believes it's limited and burnout medical staff combined with the bureaucratic oversight that's put her at the bottom of the surgery wait list. Okay, I didn't say that I was at the bottom of the list. I never said that. But anyways. But as frustrated as she is to wait for surgery, she's equally upset with people who aren't making an effort to curb the virus. The spread of the virus. My frustration lies within the people who aren't getting vaccinated, Williams says. The people who are not wearing masks, the people who are still think that this is a joke, the people who are like, oh, well, whatever, this doesn't affect me, I'm not sick. The more people who don't get vaccinated and treat it like this, the longer the wait list is for people who are waiting for surgeries.